started clinical trials in the age group of from 5 to 18-year-old, and these clinical trials are still ongoing. Part of that we already completed, which is 12 to 18-year-old, and we shared the data from those as well, and we received the emergency use authorization for the age group of 12 to 18 as well on 21st of February. The next age group, which is 5 to 12, for that age group, our trials are almost over. We have already submitted our interim report, and we expect additional reviews with the vaccinology experts at Government of India, Subject Expert Committee, as well as CDSO, DCGI office. And once that review is completed, we are also confident of achieving emergency use authorization for that age group as well. So this will be happening in the near future. So this is the overall journey of CORBEVAX from the start to where we are today. And I'm very happy that today onwards the vaccine will be rolled out across the entire country and will be serving our pediatric population with an excellent option for vaccination. The entire journey of CORBEVAX, which started about 2 years ago to where we are today, we were helped with multiple collaborators, and I would like to just share some of those with you and acknowledge the role they have played. So, as I mentioned, the start of the work was with Texas Children's Hospital, where they started with developing the strain to produce the RBD protein. After that, throughout the entire journey of CORBEVAX, we have received significant financial support from BIRAC, which is a division of Department of Biotechnology as per the Government of India. And I would like to acknowledge that they have encouraged us throughout this journey, and we have had multiple reviews with them. They also provided us with important suggestions during the entire vaccine development process. They had a very rigorous vaccine evaluation committee where they would access global experts and review the data and the progress we were making along the entire journey. So this was a very important collaboration, not only just from a financial perspective, but also from a vaccine development perspective. We also received original funding, funding at the original stage from Bill and Melinda Gates Foundation. This foundation has helped many vaccine manufacturers globally, and they also played a significant part in other COVID vaccines as well. Biologically has a long history of working with the same foundation for some other vaccines as well, and in this case also they have supported us. Another collaborator we had during the journey is CEPI, Coalition for Epidemic Prevention and Innovation. So this organization was formed a few years ago to address the potential epidemics that may happen, and lo and behold, within their first 3 years of their formation, they had to face this pandemic of this mammoth proportions, and they have helped us a lot from a funding perspective, as well as also helping us with the vaccine development process by providing access to some key testing labs and so on. In terms of one of the other company from US that has helped us is Dynavax. So the CpG 1018, which is an adjuvant which is used in our vaccine, we procure it from Dynavax, and they made that adjuvant available to us, and that adjuvant is an important part of our vaccine. And then the various labs that are extremely important in doing all the clinical trials. As you know, in clinical trials, we are assessing immunogenicity of the vaccine, which is a very complex feature. And these labs have established various methods that allow us to evaluate how the vaccine is performing. The first lab was Nexalis of Canada. Next is THSTI, which is part of Government of India institution. It's in New Delhi. And then third lab is Dr. Dang's lab, is also in New Delhi. So these labs conducted all the testing from all our clinical trials, which generated the data in terms of the vaccine immunogenicity. And last but not the least, I would like to thank all the volunteers, more than 4,000 volunteers who participate in our clinical trials, and without their participation, this vaccine would not have seen the rollout today. So we are eternally grateful to all the participants in our clinical trials. This is a very important aspect of any drug development, and we are very happy that we could do all the trials in India. We have almost 35 centers where the trials were conducted, and India has become a very important clinical trial center globally in this pandemic because of the successful clinical trials we could conduct, and that was mainly because of the enthusiastic participation by all the volunteers in this clinical trials. So I would like to acknowledge that because they formed one of the most important role in our overall development. Last part is, as I mentioned, some of the key attributes of CORBEVAX. And the first thing I would like to emphasize is this has an excellent safety profile with absolutely minimal reactogenicity. In our trials, we had given the vaccine to more than 3,500 subjects, and we did not see a single grade 3 event, single serious adverse event. We did not observe any adverse event of special interest, as they are called AESI. And not only we track the subjects immediately after vaccination, but we follow them for almost 1 year after vaccination to assess the safety profile. And so far in long-term monitoring also, we have not seen any severe events, any serious adverse events or AESI. Most adverse events that happened were very few in nature, and they are extremely mild in nature. So when I compare this to all the other vaccines out there, I'm very proud to say that this has probably the safest administration profile among all the COVID-19 vaccines. Now this is expected because our vaccine is based on a very proven concept of protein subunits, and so there is a track record of many years of vaccines of this nature being administered in an extremely safe manner globally. Second aspect of our vaccine is it generates very robust humoral, which is antibody, as well as cellular immune response. This is an extremely important part of COVID-19 vaccine. And what we have observed is the most important characteristic of any COVID-19 vaccine is ability to generate what are called as neutralizing antibodies. These are the antibodies which are generated in our sera, our blood, which neutralize the virus. And that is extremely important to prevent symptomatic infection and severe disease. So one of the most important property of COVID-19 vaccine is its ability to generate these neutralizing antibody titers. And I'm very happy to report that our vaccine generates extremely robust neutralizing antibody titers, and in our clinical trials, we showed that these are superior to Covishield in terms of not only the ancestral strain, the original strain that came from the first wave of pandemic, but also the Delta strain, which caused so much havoc in the second wave of the pandemic globally. So this is one of the most important aspects of our vaccine.